Good afternoon. Welcome to Family Health Matters. I'm your host, Wendy Bridgers, and we are here every Thursday from 3 to 3:30 on Awesome Radio 106.9 FM. We invite you to join us on Thursdays where we talk about information concerning our families, our health, and our well-being because we know the health of our families matter. And so we're excited to be here today. And I have with me in the studio Dr. Shorona Johnson. Hey, Dr. Johnson.
Hey Wendy, how are you?
I am good. I am good. We are talking about a subject that we talked about one time before we touched on hypertension. But today we want to delve into more details concerning kidney failure. And people have been talking and asking about a little bit more about what happens with hypertension and some of the complications. And so I wanted to do a show sort of in continuation and talk about kidney failure and some of the treatments that go along with kidney failure. So I know this is your specialty. So I'm going to let you tell us a little bit about yourself and a little bit about why this is such a passion to you and a little bit about how you know so much about this because I know this is your focus.
Yeah, so kidney disease is near and dear to my heart for many reasons. One is because I work with a local practice here and have been with that practice greater than 15 years. It seems like it was just yesterday. And also my mom was on dialysis. So it just kind of it's strange how things work out that I had information that could help her during the time she was experiencing her kidney failure and trying to decide what her options were. And so that is really because of the family interest and also the professional interest, the reason that it's really dear to my heart.
Great, great. So we have the right person at the table on today. So,
Lived it.
so Sharona, tell us exactly what does the kidney do before we jump into. Tell us a little bit about what the function of the kidney, and then we'll go from there.
Okay, I can tell you. So I'm going to tell you some basic things that the kidneys do because they really do a lot. So everybody has, well, not everybody. Most people have two. You can function on one kidney. Some people are born with one kidney, and kidneys help remove waste products from our body. They help with our fluid volume. Kidneys are very important for our bone health. So they do a lot of stuff. The one simple way to think about it is they filter our blood. It's kind of like if you had a coffee filter and you put the coffee beans or grounds in them and you pour the water over. Well, the water should come through, but the coffee beans or the grinds should not come through. And if you think of those coffee beans or grinds as stuff in your body that should stay within your body, so the kidney tries to keep the good stuff in our system and help us get rid of the excess waste and things that don't need to be in our system.
Great, great. So that kidney, that little, what they call it, the P shape, the Bing shape is very valuable to us. And I like what you said that you can function with one, but everybody ideally should have two.
Correct.
Okay. All right. So now tell us a little bit about our focus today. We're going to talk about kidney failure. So tell us a little bit about kidney failure, what it is, and then tell us maybe some signs and symptoms of some things that may present itself with kidney failure.
Okay, yeah. So kidney failure can be a couple of things. So I can start with the number one and two reason for kidney failure. The first in the United States is diabetes, and the second is hypertension. You know, you and I talked about hypertension a while back, and it's uncontrolled diabetes and hypertension that usually will push somebody into kidney failure. But first, I'll just mention real quick acute kidney injury or acute kidney failure, because that's a little different than what we're going to spend the most of the time talking about. Acute is something that happens quick. It's sudden. It could be an injury, blood loss, heart attack. I mean, organ failure. There can be different things that bring this on. And for acute, we know that it is sudden and it probably won't last a long time. It's usually reversible, and even people with acute kidney failure may be on dialysis for a short amount of time, but we know they're coming off. And so acute is very different from chronic kidney failure. And so chronic kidney failure is prolonged. It's slow, it's insidious, it comes on really, takes time. You don't know that it's there, so it sneaks up on you. And most people don't know they have kidney failure until they go to the doctor and have their labs checked, or they start feeling bad. And by that time, it's really in the late stages of kidney failure. There's currently 5 stages. Um, 1 to 2 are pretty good, normal functioning. And by the time you get to 5, it's time to have a conversation with me or somebody in my practice about dialysis and options.
So that's when you talk about the 5 stages. That's when the doctor or your provider tells you that you're at stage 1 or stage 2 or stage 3.
Mhm.
So with that, what numbers are we looking at? We always talk about know your numbers, the importance of your numbers, or what kind of lab values. If I was to, I've always encouraged people to make sure they look at my chart and you look at your lab work, even though your provider will go over all that information, but that's something that you have control of and you have access. So if I was looking at my chart and looking at my lab values, what are some things that I should be looking at?
Wow. So if you're looking specifically at the kidney function, the tests we use are called creatinine, and the other one is glomerular filtration rate. GFR is how we refer to it. So those 2 things will be on your lab values, and you can look at them and see the normal ranges. So creatinine is usually less than 1. Your GFR is usually 90 to 100. Sometimes it could be a little bit more. Those are the 2 numbers that really measure our kidney function. There are other numbers that show us that the kidneys aren't doing as well, but in order to really hone in on the extent of damage, those are the 2 values we look at.
Okay. So I couldn't just look at my urine and see that there was something going on with
Now,
it. So,
I can tell you some of my patients who are approaching dialysis or really need to be on dialysis will tell me, but I still make urine, or I still pee, or I still make
mhm.
water. And I was like, yeah, but that's just water. It's not filtering all the bad stuff in your system, and that's why you're starting to feel like you do. And so that's when we talk about some of the symptoms that they may experience at the late stages of kidney disease.
And I know before we talk a little more about the science, you touched a little bit about that. But going back to what you said earlier about the control of diabetes and hypertension. So I know people say, I have diabetes or I may have hypertension. Does that necessarily mean that I'm going to end up with chronic kidney disease?
No, it doesn't. It's really kind of unpredictable. I mean, we have some things that make you very high risk for it. Like if you have very uncontrolled hypertension or uncontrolled diabetes. But the best way to know is to have your physicals. Go to your clinician who takes care of you, your primary care doc or NP or PA, whoever you see for that. And they will run like tests to make sure everything's functioning fine. And then if you have some decline in your kidney function, then they will do those tests more frequently. Also have your blood pressure controlled, take your medicine. You can check your blood pressure at home. Usually we want it less than 120/80. Sometimes when you start getting over 120, the new guidelines say you're kind of having some elevated blood pressure. Lifestyle makes a difference. We tell people to not smoke. Your family history can play a part in it. But all in all, just because you have high blood pressure or diabetes does not mean you're going to end up with kidney failure.
Okay.
But it's
Okay.
a risk. It's a risk.
Yeah, it's a risk. Yeah, and that's good because I think the part about we talk about control
Mm-hmm.
managing, so that goes in and that puts you in control of your blood pressure and your diabetes and making
Correct.
sure that you are doing what you're supposed to do with those things. And I know that there's a possibility too that that people may not have hypertension or diabetes and can end up with kidney failure. Is that
Yeah, so there's a lot of different reasons. Those are the 2 main reasons in the United States, but there's some congenital abnormalities. There's some other disease processes, polycystic kidney disease, glomerular nephritis. So there are some other things that can lead to that, but those are the primary reasons.
okay? All right, and that's what we're focusing in on those today. So I don't want to get off Keith. Okay. So if we were to look at some signs and symptoms, is there anything? I know you said that you can't, sometimes you don't know it until you actually get to the doctor. Is there anything that sort of pops up that people may start complaining
You know,
of?
it depends on the individual. Some people, when they hit about chronic kidney disease stage 4, start talking about, I've been feeling kind of tired, because the kidneys also help us with our anemia or our red blood cells. So some people start to get anemic and they feel kind of tired. They don't want to eat. I can give you an example. I had a patient who's was in chronic kidney disease stage 5, and he would say, I am really hungry when I get home, and then my spouse or significant other will cook dinner for me, and then when I sit down to eat, I don't have an appetite anymore, or the food doesn't taste good. And we hear commonly in the late stages of kidney disease that the food tastes like, especially protein, for some reason tastes like cardboard, or it tastes metallic, and it just they don't have an appetite, so then they start to lose weight, and so it's kind of a vicious cycle. They have sometimes increased swelling in their legs. We call edema, because your kidneys can't control the fluid that you're taking in. And then other numbers start to change, like their potassium level or phosphorus level. So you begin to see other things. Some people can get short of breath. They can have chest pain. I mean, there's a whole group of symptoms that come on in the very late stages: itching, rashes, different things. But I have had people who have gone the whole gamut and started dialysis and told me, I feel fine, but we know by their numbers that we could not continue to keep them in that state.
Right, right. Okay. So that brings us now to tell us the treatments that you might would see. I know there's the transplant, so talk a little bit about that, and then the dialysis. You mentioned that's where your specialty is. So
Yeah.
just really just a little bit about the transplant, and then talk a little bit about the dialysis.
Okay. So transplant, you're right, is not really my specialty. When people with kidney failure get to about stage 4, we can refer them to a transplant center. We actually have one here in Greenville, and there are some other ones in North Carolina. But anywhere in your state, there's probably a transplant center. And once you're referred, the doctors there specifically work with patients who need transplants, and they will meet with your family, they'll meet with you. They draw labs to look at compatibility. And a lot of people don't know that when you get a transplant kidney, you usually get one. And so they put it or implant it surgically inside your belly or abdomen area. And so that's how that kidney functions. And some people can have them until they die, and some people have, problems with those kidneys. It just depends on the reason for your kidney disease in the first place. But transplant is an option. And with transplant, you may have to do a little dialysis, but the goal eventually is that you do not have to continue on dialysis.
Okay, great, great. Okay, so now tell us about dialysis. I know there's the two types, but I want you to talk about them and share some information with us about dialysis and how they affect our family members.
Okay. So, like I mentioned, my mom was on dialysis, and I can tell you that she was one who said what all my patients say is that I'm not doing dialysis unless I absolutely have to. But she really did not want to do it. So if I use her story, I can tell you that she was so adamant that she got to the point where she could not breathe. And so it was not an option anymore. The other option is some people choose not to do dialysis for real. I mean, they just choose, I don't want it. And it's okay. And that's a choice that they can make, and we support them in that. And there's processes and medical medications we can use for people who say they don't want to do it, but we also know that their lifespan is not going to be very long. For my mom, when she got short of breath, she went on to hemodialysis. And hemodialysis is where most people go into. You see dialysis units, you probably don't even notice them. There are buildings where you'll see patients go in, and most of them have an access of some type. It can be a catheter that we hook the dialysis machine up to. There can be something in their arms. Some people have them in their thighs. So there's a couple ways that we can have access to be able to get to that person's blood. So that's hemodialysis, and a nurse is usually there, a tech or somebody that helps you with that process. The other type of dialysis is
Well, before you do that, with the hemodialysis, so the machine does the work of the kidney.
as much as a machine can do. Our
Okay.
kidneys function 24/7. The machine, people are on dialysis for about 4 hours, 4.5 max, 3 days a week. So Monday, Wednesday, and Friday, or Tuesday, Thursday, and Saturday. So our kidneys, like I said, work every day, every hour, every minute. So we can mimic some of that, but it is the best we can do with what we have for technology right now.
Okay. All
So we
right.
tell those patients to watch your fluid, watch what you eat. You still have to be very careful with some of your choices. Whereas when your kidneys are functioning, you can kind of do what you want to do.
Yeah. And the significance of not missing dialysis.
Hmm.
When you have your dialysis days, it's important to try to keep those days and stay on that schedule.
So you do know a little bit about dialysis.
Yeah, I do. I do. But my audience may not. So I'm asking questions that I think that they might ask. So I'm trying to pull it out of you.
Understood.
Okay. Now tell us about peritoneal dialysis.
So peritoneal dialysis, and I'll refer to it as PD, um, goes in your belly. And the way our bodies are made, there's a way that we can insert a tube into your belly, and it's a small tube. It almost looks like a straw, um, and it's flexible. And so we can use that to do dialysis. And we usually train people how to do it. So we call that home dialysis. And they do training, they go home. Most people do peritoneal dialysis when they're sleeping. There's a small little machine that they use to connect it to, and the machine will put fluid in their belly, and then it drains the fluid out. And this is kind of the non-blood dialysis, because the way the body works, it helps us to get rid of the waste through that process. And I tell people, when you think about peritoneal dialysis, think about children, because many of the children who go to school, you may not know it, but a lot of them do the peritoneal dialysis at home, just for their lifestyles, and their parents help them with that. The other aspect of dialysis, the caveat to hemodialysis, the one with the blood, is that you can do that at home too. And so there's a small machine, and you're trained to do this, but a lot of people don't like sticking themselves. And there's ways to get around that. You still have to insert a needle. I mean, we have different types of needles. Some are actually dull needles where they don't really stick, and that's a whole different process as well. But I mean, you can do hemodialysis at home just like you can do peritoneal dialysis at home. And the flexibility is why people like at home versus going in a center on those regimented days, Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday.
Oh, okay. So you keep saying that you can be trained. So you referring to family members?
The patient, my mom was 68, and she did home
Oh, okay.
hemodialysis herself. So the
Okay.
patient is trained. Now, if you want to bring a family member along with you, we highly recommend it, because I mean, I think the more people understand what you're going through and what you're dealing with, to have a support system. I mean, our
Mhm.
literature has said that people do well, very well on dialysis, if they have a strong support system, and that's family or a partner or somebody to help them with that process, or even just the psychological aspect of it, because it is a chronic illness that's being treated. And so I think family is important.
Yeah, and that's why I was thinking that this was an important session to have so that families can understand, because I know that sometimes patients or clients come back and say, I'm just so tired after dialysis, and your family member don't understand. You think about it, you just said, it's maybe if you go to the center, it's a 4 or 5 hour process, right?
Yeah,
And
yeah.
you're thinking that the patient goes and sits in a recliner for 4 and 5 hours. But tell us a little bit about what happens during that 4 to 5 hours so that people can understand why that
So
they may feel tired.
yeah, it's true. So our patients, it's funny you say that, because I just left the dialysis unit seeing some people on dialysis, and one of the ladies there mentioned, she goes, I went home and I just felt terrible. And so we talked about the reasons that she probably would feel terrible, and what I could do as a clinician to help her with that. So the patients are enter the dialysis unit, and they have a set time. They have a chair time is what we call it, because if you've never been in a dialysis unit, it's a lot of recliners lined up, and so there's very little privacy, because you have your chair neighbor on both sides. Some of them have a couple beds, and so the thing if I can like anything about dialysis unit, is the family that's formed there, the support, because you see this person on the same days around the same time for years. And so,
Mhm.
you begin to have a bond with those people um, that sit beside you in the chair. And so they enter their chair time, they're put on a chair. It takes a while for the machine to be set up. We try to have the machine ready for them. It takes a little while for them to be cannulated. That's where we put the needle in the access that they have, or we hook them up to the catheter that they have, and then we start the machine. And part of what the machine does is the blood comes out of the person, goes through the machine. It's cleaned during the machine. There's a filter that's there that helps clean the blood, and then it's returned back to the body. During this process, when we're filtering, we're also taking off fluid. And so, an example of the patient today, she said, I think I was pulled too hard the last time I was here. And so, what she meant by that is, I don't think I had all the fluid that they tried to get off me. And so I started to cramp. I didn't feel good. I felt drained when I got home. It took me a couple days to feel like I recovered. And so we talked about her diet and what she was drinking. And I also looked at her numbers to see if I could adjust so that we don't pull so much or take so much fluid off her. And so those are some of the things that can happen on dialysis. And then at the end of your hours, however that's set, and that's individualized for a lot of people, we disconnect you from the machine and then send you on your merry way.
So after the dialysis, then you can go home and do whatever. So are there restrictions that
Yeah.
patients have? So they're back to should be as much activity of daily living as they feel comfortable with.
Yeah, I actually have some people, we have different shifts, like morning shift, evening shift. I have some patients who come to dialysis at 4:30 in the morning, get on the machine, leave at a decent, hour in the morning, and they go to work. So, you can work, you can travel. There's dialysis cruises. I mean, it's not a debilitating illness. I mean, it's something that you really have to treat like a chronic illness, and you have to understand the significance of your disease process, but it does not limit you having a life.
Okay, that see, and that's important to know because sometimes people feel I don't what is the word compassionate or well not so much compassionate, but they feel like people are limited or disabled because they have dialysis or on hemodialysis or do peritoneal dialysis. Because I remember one a friend of mine told me, don't treat me any different. And so we have to be in mind, families, to know that just because I like what you said, that people can go on and live a normal life and still do their dialysis. So what would you say, or what comments or anything that you would, encourage family members that's sort of helping the patients or their loved ones go through trying to decide about peritoneal dialysis, hemodialysis, or transplant? I
So,
mean, I know it's
so
individualized, but
I would ask the family members to go with the patient to their nephrologist, to their specialist appointments, and we have education classes that are group classes, and they can ask questions. And I think it's really good because sometimes there's a group, and you may not think of a question that you may want to know. And so I think it's very important for family to participate in the appointments, understand the processes, and then help them to talk about and make a choice. Um, I can tell you that it just depends on what the person wants to do. And if you choose one type of dialysis, you're not stuck with that.
mm,
You can change. I mean, you may do one type for a year and you say, I'm not sure I like this. Can I try peritoneal dialysis, or can I try home hemodialysis? And we can help you do that in transition. We want it to be something that's tolerable and that you can live with, and we want you to be okay with your choice. But we can't make the choice for you. We can make suggestions, but we're there to support you in your choice and educate you on your choices, as well as your family.
good, good, and it's good to know that those resources are there. Now, and I don't know, I'm sure you have people that are specialists who handles this part, but the insurance piece. What can you share if somebody's worried about the fact that I can't afford it, or is my insurance going to pay for it? Can you shed any insight on that?
I can share some. So each dialysis unit has a social worker, and I
Oh,
mean, and they actually talk to the patients during that process about their insurance. I can tell you now, dialysis is one chronic illness or treatment that Medicare pays for. And I know that you probably say, well, Medicare is for people of a certain age, and but dialysis is the one chronic illness that Medicare does cover. So anybody on dialysis can, well, is automatically, um, almost without exception, given Medicare. I'm sure there's a few exceptions, but it covers dialysis.
Oh, okay.
And then
Okay.
private insurances, of course, they also cover dialysis. They even
Okay.
cover home dialysis, both of them, Medicare and private insurances.
Okay. So that's a fear that we can get people to erase out of their mind that if
Hmm.
they need this, they need to go ahead and pursue it and make
Yeah,
sure that.
and you have to work with your insurance company, of course. I mean, there's sometimes co-pays, there's other things, but the majority of it is usually covered by one of the insurance companies or Medicare.
Okay. And then having the social worker
Hmm.
there, that
Yeah.
that sort of helps a lot too, I'm sure.
Yeah, and we
So
try to support. I mean, there's medicines you still have to take, even though you're on dialysis, and sometimes there's some grants that we have access to and different programs through the dialysis units that can help support the patients and the financial um, strain that's sometimes put on the family because once you're on dialysis, you can work, but that initial period, people are scared. They're trying to adjust. They're trying to figure out how they feel. So there may be a time period where you're off work with FMLA or your family members. So all those things have to be considered.
okay, good. So one last thing, and you mentioned the access. Any precautions that somebody may have to, if they have an access that they need to be cautious with because they
Yeah,
might.
so I'll mention my mom used to say that's my lifeline. And so she felt like, and she took it, and a lot of my dialysis patients will say it's my lifeline because if they don't have that access, they can't do dialysis. And
Mhm.
so they guard it very carefully. And so, in hospitals, you shouldn't take blood pressures on that arm with the access. Don't wear tight jewelry on it or tight banding around it. Make people very conscious of it. Some people have bracelets that they can wear to say, this is my access or don't use this arm. So you do have to be protective of that access or that arm. And if you
Yeah,
have the catheter in your chest, you just want to be careful with infection. So there are some rules that go with all the access. I mean, because it's man-made, so there's always something that we have to consider to be careful with.
got to protect it. Well, Dr. Johnson, thank you so very much. You shared wonderful information with us. So again, I thank you for being here with us today. Awesome job. Yeah, yeah,
Thank
yeah.
you. Thank you.
And
It was
again,
it was an honor. It was an honor. Thank you, Wendy.
you're welcome. Thank you. Again, I'm your host, Wendy Bridgers. We are here every Thursday from 3 to 3:30 on Family Health Matters, Awesome Radio 106.9 FM. And we're on Facebook, Awesome Radio Facebook page, and Awesome Radio YouTube and cable. So please, please join us and watch these educational events. They are wonderful. And again, I thank you and thank you, Dr.